Hi, Ukarumpa parents and caregivers. My name is Brianna Nystrom White, and I am an Ukarumpa UIHS grad, and now I'm a licensed marriage and family therapist. So I wanted to talk with you today, and thank you for your time and listening, about some of the things that I like to tell families that I'm working with when the kid in the family has gone through something traumatic. And a lot of the kids in your community have gone through something traumatic. So here's some of the basic information that I think is helpful for a lot of people to know about what a trauma is and what it can cause in terms of how kids change how they act and what can be done to help. The first thing to know then is that a trauma is a sudden, unexpected moment of sheer terror. It's more than just something stressful, not something you see coming that you could prepare for. It's really, really terrifying and overcomes your ability to cope. And what happens as a result of the trauma, meaning the injury that it causes, is PTSD, and that's post-traumatic stress disorder. There's a history of how we've developed our understanding of how traumas affect people, including kids. But from the best that we know about it now, it's the only psychological diagnosis that has a known cause and starts as suddenly as PTSD does. One day you're perfectly fine. The next day you have a complete situation, a complete injury. And it can happen for very young children, and sadly it doesn't get better on its own. One of the things to know about a trauma is in the first month, almost 100% of the people really feel the impact of the trauma, and it affects how they feel, affects how they're thinking, how they're doing. But then after about the first month, about 70% of people are feeling much better. So that's most people. That's good news. The rest of the 30% though, the bad news is that those 30% pretty much need help to get better, and they don't tend to get better all by themselves. It can be really hard to accept that fact that about 30% of the people who go through a trauma don't get better on their own. It happens so suddenly, they look fine. This emotional, psychological injury is invisible. And especially for kids, they change so much in their early lives that we might be able to write off for a little while. Oh, this is just maybe a normal variation in how they act. Maybe they're going through a phase. But when you start to see the post-traumatic stress symptom pattern that trauma experts can, and you can too with a little information about it, a lot of these changes have a pattern. And when there's a trauma and you know the pattern of trauma symptoms, you can see, oh, okay, these differences did start at the time of the traumatic event, and they're fitting that post-traumatic stress pattern. So what are some of the things that we see in kids who have gone through a trauma? For young children, we see they're less interested in play, and they also may play out the traumatic event or want to talk about it a lot, or suddenly have thoughts about it pop into their head. They might become fearful about day-to-day situations that they used to be okay with. The most common thing is fear of the dark and going to the bathroom. They might lose the ability to talk as well as they used to, or have more bathroom accidents, or just generally become less independent or capable than they were before. We also see little kids, that's this 3 to 6 year old range, getting overcautious, startling easily, having sleep disruptions, having a hard time falling asleep, or bad dreams. And they might avoid reminders of this traumatic event, like not want to go into certain places or do certain things that remind them about it. The kids of this age can also have more and bigger tantrums, which is definitely not fun for them or for their family. And you might also see these young kids drifting off to be alone more, isolating themselves, having trouble concentrating, like needing a lot of reminders that they don't usually need, or just generally having more negative emotions, like more sadness, more anger, less happiness in their day-to-day. And as you might recognize, any of these could seem normal. Like kids sometimes have a difficult time sleeping, or it's normal for a 4-year-old to need reminders. But if you're seeing a lot of these and they start to happen right after a traumatic event, it's time to be suspicious and think they're experiencing some trauma impacts. For older children, there are very similar set of issues that come up. And this, by the way, for older children, it's really similar to what it looks like in adults. So these types of trauma symptoms include having upsetting thoughts or pictures about what happened pop into your head, bad dreams about it, feeling as if it's happening all over again, feeling really upset when you're reminded about it, having strong feelings in your body, staying away from the people, places, or situations that remind you of it, and sometimes not being able to remember part of what happened. And the next category is really important. It's starting to have negative thoughts about yourself or other people. And a lot of times people don't connect that to having had a traumatic experience. But changes in the way you think, starting to feel like the world is an unsafe place, or feeling hopeless about your future, that's a big category in the trauma symptoms. Sometimes people will blame themselves for what happened or somebody else. Having bad feelings like angry, guilty, ashamed, not wanting to do things that they used to do, or feeling close to people. Not having as many good or happy feelings again, just like the little kids. Feeling mad, extra fits of anger. This is now a teenage style tantrum instead of a little kid style tantrum. Older kids and adults might start to do unsafe things, or be overly careful or on guard. They could get jumpy or have problems paying attention, and might have trouble falling or staying asleep. If those are things that you're noticing happening for your kid, even just a few of them, it's a really good idea to talk with your doctor or staff care or the school to look at what resources are available for helping your kids get evaluated for PTSD. We'll also talk about next what you can do as a parent or a teacher or somebody who is supporting these kids, whether they're having a strong reaction to a trauma or whether they just seem okay, they're functioning okay, and they want to talk about it. One of the things that's really important is to provide space and ask directly how they're doing, how it's affected them, because one of the key indicators that somebody's struggling with the traumatic experience is that they don't want to talk about it. In fact, the more they don't want to or can't talk about it, the more concerned you should be. If they don't want to talk about it and they refuse, you can let it drop, but you should take note that they're highly likely to be in distress and need help. And that's a good time to bring in a professional who knows how to work with them about this in a way that helps them prepare to be able to talk about it. For those that do want to talk, space to talk, a chance, your full attention when they do talk. And don't be alarmed if they want to talk about it a lot, especially little kids. They want to talk about it again and again and again and repeat the story, ask every question about it, and that's okay. It's not a bad sign, and it's okay to go with the flow and talk with them about it until they're done. If they're stuck in talking about it, it's okay after talking about it for a little while to gently distract them or offer them something different to think about or talk about. Older kids will be thinking about, where is God in all of this? And there's so much to be said about that I will leave to other discussions. But one of the things that I see coming up a lot that can cause a lot of trouble is if people think that bad things only happen to bad people. So either I'm bad and that's why this happened, or I'm not bad, so this isn't bad either. It was actually a fine thing. It's not a bad thing. That's a dangerous bit of theology there. And what I suggest instead is helping kids to see where there is evidence in the Bible that bad things happen to even people that God is really pleased with. And I like to start off with the basics of just in Jesus' life, not everything went well, and God was very happy with him. And as well, after that, there are lots of examples of another really helpful thought to remind yourself and the kids that you're talking to about is that whatever is happening in our lives, no matter how hard it is, God cares about it and is with us in it. Another common reaction to trauma, like we've said before, is to want to avoid what reminds you of it. When this happens, you want to gently encourage the kid or the teen to go ahead and face it, to remind themselves that they're okay now, the earthquake is not happening now. The situation is different and safe now. And to go ahead and face it anyway. If your gentle encouragement is not working though, that's a really good sign they might need a professional to help them, because that avoidance is one of those big trauma problem flags. There's a significant aspect of what an earthquake is that I wanted to talk about too. And remember at the beginning we talked about how a trauma is a sudden and terrifying event. There's no natural disaster I can think of that's more sudden than an earthquake and less predictable. And that can make an earthquake a particularly scary kind of event. You don't know when it's coming. You don't know what it's going to turn out like, if it's going to be minor or if it's going to be deadly. And that makes it harder to say things like, well, we'll see it coming and then we'll take action, like you could with a typhoon, for example. So what do we do about a natural disaster type like an earthquake? You can make a safety plan and then talk about what you've done. What are we going to do when we start to feel the ground shaking? And what have we done to the house to try to make it safer? Like maybe not storing something that could fall right down on heads very easily. That's just an example. We won't cover earthquake safety here. But for unpredictable events like earthquakes, the best you can do for reassurance is that safety plan, because you can't promise it won't happen, or it will be gentle when it does. So to wrap up, please contact somebody to look for resources. If you find your kids are showing any of the symptoms that we talked about, if they're off now, if they are blocked from being able to do the things they usually were able to do, there are really good treatments for PTSD for kids now. And most of the children get most, if not all the way better with PTSD treatment, especially early treatment. So don't let your kids suffer at length when there's treatment that can help. And now I'll say goodbye and thank you for your time, and by watching this, your willingness to face your own uncomfortableness that is a natural part of going through a traumatic experience like an earthquake. Your children will tremendously benefit from your willingness to see any problems that are coming up and to get them the help that they need. Thank you again for your time. Bye-bye.